Well, it appears babies have been communicating secrets about their brain, but we couldn't understand until now. Dr. Nathan Stevenson and Dr. Kartik Iyer, in collaboration with some researchers in Austria and Finland, have found a non-invasive way to chart a child's brain age while they're fast asleep. And happily they join me now.
This is a QIMR Berghofer Medical Research Institute podcast.
Hi, I'm Claire Blake. You're listening to BodyLab. Kartik, you said just a moment ago you've been in the tunnel. So you've been in the tunnel developing this tool which would help the whole world intervene at a very young age when babies' brains are very plastic and we can change their outcomes for their whole life. So what have you been doing in the tunnel?
It's a long, winding, dark tunnel with the light as further away as possible, and we got there in the end. And the last 3 years have really been to try and develop the best tool possible. Work out things like what's the best neural network, how are we actually going to capture all this brain function information and actually get an accurate measure of brain age. Once we were able to do that and actually publish the work, then we've come out of this tunnel going, oh my God, there's just so much to look at now. Like we've got things like different neurodevelopmental disorders. How is this diagnostic assessment of brain age going to look? When you present it to a clinician, can they visualize what it is? Can they look at it as in terms of a report and go, okay, well, I understand these numbers now. So
can it be something a GP can put in a battery of tests?
Yeah, and that's what we'd love to see. And there's a terrific children's research centre linked to the Queensland Children's Hospital. Almost every study that they do over there on child development, particularly child brain development, they can use this measure as a complementary measure. And so there's no reason why the sort of educational measures of educational attainment or the normal measures with which they determine how well a child is developing can be interpreted in parallel with this measure that we've developed. Just the contrast between them would be interesting in its own right.
And we've already started talking to them, and that's exactly the sorts of things that the challenges that they're facing in the community and getting this information, educational scores or cognitive assessments or language development, or even things like sleep function and how well they're sleeping overnight, sleep efficiency, those sorts of things, they're doing very, very well, but only as well as they can in children. So if you have a brain age assessment, it's highly complementary. It's almost like a catch. If they do miss a sleep assessment or a developmental assessment, a brain age is there to actually give some sort of measure alongside their tools.
Shouldn't this tool of yours be a starting point?
It is, absolutely. It's absolutely a starting point. The big problem we have, and it's one that we've always boggled my mind, is how much money we spend on adult health when we could be spending it on kids' health.
Well, we know just under half the medical budget goes to older people. What percentage of the budget goes to paediatrics?
We tend to see less than 20% of research funding goes towards the paediatric space. It does boggle the mind because these kids become these adults.
Yeah.
And we know that there's a terrific programming of health that comes from when you're a child. Children with known health difficulties maintain these health difficulties and take them into the future. So the adult patients that we treat, the core of their frailty comes from when they're in childhood. And if we can somehow improve that, the benefits to the budget would be huge.
Your results really closely matched those of your collaborators in Finland, didn't they? And Austria. Babies' brains pretty much the same worldwide.
It seems to be, yes, particularly for the sort of signals that we look at. So the underlying sort of electrical activity that drives the things that we can detect on the EEG signal and the ECG signal are very similar across geography and race and humanity, really. These signals are some of the most robust, actually, to changes in humanity that we see. So they're very widely applicable. Once you get a good estimate or a good measure from one population, it does translate to other populations in a broader sense relatively simply.
Are you surprised everybody isn't jumping on this?
Well, we are, but because we're biased.
Yeah,
we think this is fantastic. But it is a busy market out there, and there are a lot of people fighting for recognition and fighting for research funding.
And I guess you're in diagnostics, and it doesn't seem as sexy as a cure.
So this is leveraging the EEG, which has been around for more than 50 years. It's been used clinically They record it at the bedside in children, not only when they are visiting in clinic, but also when they're in the intensive care unit. It's been recorded all the time. But the reason why the brain age is a next step advancement is because what has been traditionally looked at in the EEG are things like features of the EEG, like how the signal evolves over time, the spikiness or the amplitude of it. We have looked in the past, and a lot of EEG researchers have looked in the past, and even clinicians, at things like alpha power and entropy and fractal dimension. These are all like obfuscated things, but they mean a lot in terms of the EEG field.
Yeah.
But the neural network approach was to consolidate on these things. And part of the reason why we were in the tunnel for so long is to make sure that the AI side of things was also making sense in terms of the features. So that's why when we looked at groups across Helsinki and Brisbane, we knew that the features of the EEG across childhood were similar. And then the measure from the AI was also making sense with the features. So that was our link, because there's this whole thing with artificial intelligence these days that it's a black box. You don't necessarily understand what's going on with it. And so we spent an inordinate amount of time trying to make sure that the AI was reflective of actual EEG features that are important to EEG people and also clinicians, but then also having some sort of meaningful measure at the end and computing a brain age.
But how accurate is it, and does it change in accuracy given the age?
Yeah, so for the older kids that we looked at and moving into adolescence, we found that we could determine your age to within about 6 months using the EEG activity. And this had a sort of decreasing trend the younger you got. And by the time we reached sort of preterm babies who are 28 weeks old, we could determine their age to within a week.
That's extraordinary. Is that because their brain's changing so much at that stage?
It is, because the younger you are, the more rapid your growth. What your brain activity looks like today, there's noticeable changes on a daily basis, whereas as the older you get, that those changes aren't as prominent.
When you're born, you have billions of neurons. Those billions of neurons get pruned away as you age. You don't necessarily need all the connections that you need in the brain. So that's why a brain age is so sensitive at an early age. And the accuracy of the brain age does decrease over time, but that's also reflective of how a child ages during adolescence and early adulthood as well.
So we're brainier when we're born.
Yes, you've got more connections between your neurons.
Oh, that's a bit depressing.
And they just get pruned. But the pruning is what, so every baby can play the piano, but you prune it so you can play the piano really well is the sort of idea with maturation. You get rid of things that are useless and you build expertise as you grow older. I don't know if any baby can play the piano, by the way, as an analogy.
Just look on YouTube.
That's right.
Yeah. So when we talk about like neuroplasticity, there are terms like experience-dependent plasticity and experience-independent plasticity. So, when a child is born, that's when the environment plays such an important role. So as soon as you're born, you're exposed to like all these things, different changes in light, sounds, and, there's so much for the brain to compute and actually understand or filter out what is noise and what is signal.
Right.
That's what the EEG is reflective of. There are billions of neurons when we're born, but babies are really, really good at deleting connections or removing connections that they don't need because they're super at just going, okay, I need to know what mum's voice is. I need to know how to, drink milk from mum. I need to know how to recognize my parents' voices as I grow older, getting familiar with how to grab objects, all those sorts of things. They're really complex processes. And by ways of that, they refine their brain, they refine their connections. Yeah. And that's why brain age is really sensitive at that young age.
Does it stop pruning? Because I feel like I'm pruning right now.
Never stops. The person you are today is not the same person you'll be tomorrow because it keeps changing and your brain is always doing something.
Basically, in the future, could it be on a small device? Would it be accessible for everybody in countries that don't have the same healthcare systems that we do?
Yes, definitely. And the mobile technologies and the miniaturization of a lot of technology is really well suited to the wider sort of spread of technology such as this.
At the moment, you've got people at QCH using it. How big is that machine or whatever that?
It's quite big. It sits on a stand. It's about the size of, I don't know, a mechanics toolbox.
In our office, for example, we've got this wireless unit that's handheld, and you can move around with that and attach it to a cot. So it's not out of the realm to have these, mobile units of EEG cheaply made in a way as well. This is what we sort of see as the future of EEG or future of brain age monitoring, is that you can roll it out to lower socioeconomic settings. You can go into these developing countries and actually have these EEG units record this in real time.
Yeah. And one of the great advantages of EEG is that it's non-invasive and passive. There's nothing that's being injected. It just sits there and happily records your activity. And you can get little boxes that'll even talk to your phone now, and then your phone will send the data up to where it needs to go. So this sort of technology has been coming for a while. There's still a lack of a few killer apps that really make it ideal, but it's definitely getting there. With a bit more research, we will certainly get there within the next 5 years.
And if there's a baby of concern, you can put these on as soon as they come out of the womb.
Yep. When we're looking at, actually, one of the interesting things we're looking at is trying to integrate this into the retrieval service for neonates who have a bit of trouble at birth in remote areas or rural before they get put on the bus or the helicopter. They can whack this on their head and then determine what's going on in the brain and really feed that information down to the clinical team at the neonatal intensive care unit, and they can really hit the ground running once the baby comes in.
Would this be helpful for those born with Down syndrome or epilepsy?
Yeah, exactly. So it's really providing the tools early on and being able to monitor these things as the child grows or develops, because if they are at risk or they have been diagnosed with these sorts of conditions, it's a lifelong challenge for the parents and the caregivers, because their child is going to develop at a different rate to other children. Autism and ADHD, these are other neurodevelopmental disorders that are potentially more complicated to diagnose early in life. In saying that, something like a brain age is able to provide that objective view into how a brain function is developing in those children. And it's something that can be measured over time as well. You can actually look at how a child's trajectory evolves as they age.
Where could you go with funding? It seems like the opportunities are endless.
This is about empowering the clinicians that are going to use it, and not only clinicians, but potentially people working in areas of sociology or education, because there's a big interest in terms of how children learn. And not only, this concept that we talk about what is normal these days, a normal child or a typically developing child, there's a big variation in that. To actually capture that properly, you need really sensitive tools, or you need good tools that are objective that can actually measure that.
Funding is a concern for us. I mean, we know that paediatrics is relatively underfunded compared to the larger pile for funding. And the larger pile of funding itself is not massive for us to choose from. The other issue that we have with our funding is that diagnostics aren't particularly sexy. We can't point to a diagnostic being a treatment that immediately will cure a condition. But it is the future of medicine. And what diagnostics do is that they really subdivide humanity into really specific tiny little parcels. And we know this subpopulation will benefit from this treatment. And if we can get those diagnostics applied earlier, then we know that those interventions or those treatments are highly more effective. Diagnostics are sort of the hidden magnificence of medicine. Without them, the system will fail.
Non-invasive, you can put it on their head, it's cost effective. I don't know why people aren't throwing money at you personally.
Me too.
If you'd like to throw money at Dr. Nathan Stevenson and Dr. Kartik Iyer, go to QIMRberghofer.edu.au. Thank you both.
Brilliant. Thanks, Claire.
Thanks, Claire.